Hi, I'm James.
Hi, I'm Rian.
Pleasure to meet you.
Hi, I'm a pharmacy student. Well, actually, I'm a grad student in the College of Pharmacy. I'm doing a PhD in pharmacy care administration. My focus is we have a lot of technology that provides medical information. I'm interested in drug information in particular and how physicians and pharmacists use it. You may assume that whatever information you get in an app is accurate. That's not my assumption, so I plan to evaluate that.
Great.
Yeah. You said industrial processes, it was trying to figure out what you meant.
I think I agree. Yeah, anytime you can, bring it down to earth, and industrial processes, that's great. But tell people product, something that they can really grasp. So like pharmaceuticals, medicines, right? All kinds of different categories. Beautifully done, though.
Hi.
Hi.
Thanks very much for joining us today.
Thank you for having me.
So tell us a little bit more about your research.
Well, I study medical apps. There are over 65,000 apps just for medicine and health right now in the market. And my focus, I'm looking at apps that health professionals need to use so that they can get information on medicines more efficiently. And actually, I'm checking to see if that information is actually accurate and complete and evidence-based, because we assume that when we get information on the internet or in our phones that is correct. That's not always true. So my job is to check to see, does it make sense? Is it correct? Where'd they get it from? And stuff like that.
So you're fact checking the applications.
Yes, fact checking as well as their sources, because we get information from various sources, and a source may be convenient, but it may not be up to date. It may actually be outdated.
So, what kind of people are using these applications?
Various. It's open to patients, health professionals, and, well, just about everybody. Anyone who has a smartphone, a tablet, they may even have apps that you can have on your desktop. So so it's open to everyone. But because there's so many apps that are designed for patients, for instance, disease management apps, that world is another PhD thesis in itself, on its own. So I'm focusing on health professionals, because we can't, as health professionals, we can't keep everything in our brains. You may think your doctor knows everything. No, he doesn't. He has to check somewhere for it.
So doctors are using these applications?
Oh yes, for sure. Doctors, nurses, pharmacists.
What are they looking for?
Well, the apps that doctors tend to use, we have apps for diagnosis. So you can put in patient information, let's say weight, height, blood pressure readings, and determine the cardiovascular risk. So you could also add cholesterol levels. So we have apps that tell you about diagnosis, risk of heart failure. There are also apps that can monitor patient progress. So apps that allow you to sync to the patient's health record wherever that patient is, depending on the network that they're on, and determine their progress, document if they're seeing a specialist. That specialist can go into the app and document what that patient has, what their update is per se. We also have apps for treatment, therapies. You want to ensure that what they're using, let's say you're taking something for headache that is not clashing with, let's say, medication for cholesterol, that's not causing more harm than good. So it's the whole spectrum of medication use. There's an app for that.